and welcome to Bronx Talk. Current data shows that while the most recent rate of overdose deaths in New York City has declined ever so slightly, it has more than doubled since 2018 and nearly quadrupled since 2013. Unfortunately, the overdose death rates are highest in our borough of the Bronx, specifically in neighborhoods in the South Bronx, where rates are more than twice the New York City average. As part of their 60-year record of excellence in the field of treatment of substance use disorder, the Samaritan Daytop Village Peer Alliance Recovery Center, known as PARC, P-A-R-C, has a healthy lifestyle initiative that emphasizes the crucial role that nutrition can play in stabilizing mental and physical health and is a vital tool, surprisingly, in substance abuse recovery. Two PARC experts have joined us tonight to discuss not only their own substance abuse recoveries, but also the role Samaritan Daytop Village's unique nutrition programs can play in combating substance abuse. Please join me in welcoming the Bronx Assistant Director of the Peer Alliance Recovery Center at the aforementioned Samaritan Daytop Village. It is Annette Evans. Ms. Evans, nice to have you with us.
Thank you so much for having me, Gary.
And the Head Wellness Ambassador at the Peer Alliance Recovery Center of Samaritan Daytop Village. It is Jamel Lewis. Mr. Lewis, nice to have you with us.
Thank you, sir, for having me.
Ms. Evans, let's start with you. Before we talk about nutrition and the recovery programs, I think it's important to talk about Peer Alliance Recovery. You've had your own struggles with substance abuse, right?
Yep.
So let's talk about your journey, and then we'll use that as a jump, and also Jamel's as well, as a jumping off point to get into how we're going to treat this stuff. So tell us about you.
So I'm Annette Evans, born and raised in Spanish Harlem and lived in various different places in the Bronx. Due to the impact of trauma and various different life situations, wound up with addiction issues and problems, including incarceration.
Wow. And about what age did it start?
I was probably about 30. It was late.
You were 30 years old,
Yeah.
so you're already an adult.
Yes, I was already an adult. Due to lack of coping mechanisms and stuff like that, I lost the family members back to back, lost my ability to cope when seeking. And
I'm so sorry. Aside, before we even get to the substance use, I'm sorry that you or anybody has to go through that.
Yeah, but I think it's a good way for people to identify some of the things that might happen in the community with people who are using substances and how they can get out of it in a healthy way.
So you were addicted and then and incarcerated for other crimes or for possession of drugs?
Yeah, possession of drugs. I was never a hardened criminal or anything.
Well, we were just measuring it. Okay.
Yeah, yes.
And then what did you do to get out of it? Was the incarceration part of the process because what you were doing wasn't available? Although, of course, the struggle for somebody in that circumstance is also significant.
Absolutely. I can say the incarceration definitely was a segue into the recovery and treatment process.
It inspired you?
It did. It did. I mean, for one, I didn't want to be behind the
You didn't
wall.
want to go do that again?
No, that wasn't going to happen again.
And how long were you in?
I was there for about 18 months.
And so what did you do? You find other people who you didn't find beforehand that got you in?
Absolutely.
Got me into this mess?
It was a correction officer who put me into a treatment program while I was incarcerated. And then from there on out, I continued my recovery process outside.
What in a quality treatment program worked for you? Obviously, everybody's individual. So what was it that helped you really get to a point where you could say what you do now is that I'm free of it?
What got me to that point, I think what was my turning point overall was that I went back to school and I went back to educate my community on how to receive me back into the community.
So it was using what you learned to help others do better. Now, look, folks, I'm just going to tell you, I happen to know she has a master's in social work from Hunter College's Silberman School of Social Work. You're considering now a doctoral program.
Yes, either doctorate in social work or psychology.
Wow. Well, congratulations. And for you, it's a source of significant pride.
Absolutely.
All right, let's go, Mr. Lewis, a Marine Corps veteran, aren't you?
Yes, sir.
Talk about how you got into trouble and into to be a substance abuser?
Well, again, I just want to say thank you for having me. And,
Sure.
And my journey started a long time ago, and but just to keep it brief, is that about a year ago, I wasn't with the rest of us. I woke up in Albany Medical Center. I was involved in some situations that someone ran me over.
Oh,
And-
goodness.
And when I woke up, my mom was standing over me, right? And
Were you high at the time? Was it part of that whole picture?
well,
or not really?
it was part of that scene. I was going to actually go get my substance, and I had owed someone some money. And they actually ran me over, and when I woke up,
Oh, so it wasn't like you were just hit by a car because you
No.
were stumbling around high. It
No.
was they went after you.
absolutely.
Excuse me,
Yes,
that
sir.
is yet another aspect of this, aside from what it does to you, but it puts you in scenarios that clearly are not healthy.
High risk.
It's hard to mention, hard not to mention. Go ahead.
Yes, sir. So, there were multiple turning points along my journey, but one of the huge ones is that while I was in the hospital, my mom was standing over me when I first woke up out of not being with the rest of us. I opened my eyes and my mom says, "Not, are you okay?" But she asked me, "Do you know who did this to you?" And I said, "No." She said, "God did this to you because you just weren't getting it, Jamel." And that was one of the hugest turning points is where I wanted to, live life again and be more productive for myself, for my family, as well as for my daughters. Mostly, I have 5 of them, and then.
Congratulations.
Thank you. I decided to go to a 28-day program upstate New York in Albany, and for myself, I just knew that the 28 days was not long enough for me. So on the 27th day, I told my counselor, "Hey, I need door-to-door service to somewhere that is long-term," and
Because coming in 28 days, hello.
yes, I did get a little more weight back on and things like that, but I already knew that I would have set myself up for a disaster.
And so you went into another program.
Yes,
Was it
sir.
Samaritan?
Absolutely.
Ah.
And that's where I went door to door. I went from upstate right to 43rd Street Veterans Program, which is where I really started my wellness journey. And
About how long ago was that?
and that was last March.
Wow. So this is very current.
And yes. So I have about 15 months of sobriety, of what I say wellness on my belt. And while I was at the 43rd Veterans Program, Samaritan Village has given me so many opportunities to actually give back. And that's the best part about it is that I was able to get my recovery coach credentials, as well as do the at PARC.
So we'll get into all that. But what I want to get into is you learned something. Both of you learned something from these traumatic events, and I'm going to guess that the idea is not to have somebody have to go through a traumatic event to kick the habit and turn their lives around, right? Because you both had something that inspired this moment. I'll ask you both the same question. What does the public not know or understand about people who are struggling with substance abuse? The general public may see them in the streets. I used to have an office on 149th and 3rd Avenue, so I know what's out there. And people see that, and it gets into politics, and it gets into all kinds of things. What doesn't the general public understand about this disease, this problem?
Well, it's an outstanding question, first of all.
Okay.
And
That's why I do what I do.
For myself, what I believe that the public doesn't really understand is that the substance abuse is just a symptom, and really it goes back to most likely a traumatic event or some type of trauma that may have happened
in your
the
life, other than the incidents that you guys were talking about.
Absolutely. where just as Miss Evans was speaking about coping and the way that we may look at things, it may have worked in that environment, but it's not working anymore. So defaulting to being your own doctor and prescribing yourself a substance has happened to a lot of people.
A lot of people has gone wrong. This is going to, after she finishes, this is going to be a perfect segue into the nutrition program. But so what does the public not understand about this whole issue?
To be fair, I think that the public really needs to know that people are people first, right? And
I'm smiling.
something
I'm so
happens.
happy you said that.
Yeah. So in my school continued education, I learned that we don't ask what's wrong with you; it's what's happened to you. People don't usually wake up and say, "I want to be a drug addict. I want to be,"
That's great. Well, I just want to review that. So it's not what's wrong with you, like what's wrong with you? You're taking
What's
drugs
wrong
and doing
with you?
this, but it's what happened to you.
What happened
that
to
got
you?
you here.
There's so many areas that people don't just forthright say. I've been impacted by sexual abuse. I've been impacted by a parent or a lost parent or somebody who might have been taking care of the household who's suddenly gone. And you have this young person trying to go to school and develop and grow into their own self and taking on the role and responsibility of a missing parent, or maybe not the parents are not there.
Yeah.
They may be working parents, but there's something going on.
There's so many issues.
There's so many aspects.
Turn on your TV one night and see what's going on out there, especially in our home borough, the Bronx.
I just wanted to add that there's also the healthcare system where we have education. Department of Education is usually the first segue for young people outside of their household. There's something happening. Children show you signs and symptoms when things are happening. There's people who are undiagnosed or, may need additional medication or a higher level of care. And if people are not aware of that, they will lose them to the streets.
There's a very popular middle school in the Bronx that has a big sign outside. This is a nice way to introduce this part of the discussion that says, "Hungry children can't learn." And so we'll let you talk about the establishment of the nutrition program. Just why is peer-to-peer important? Why is it most effective if you talk to some of the people who come into the program?
I'm glad you asked that question, because peer-to-peer has the opportunity to open any type of rapport with just being a person, somebody to listen to be talked with and not at.
Who knows firsthand what you are going through.
That's right. I've been down that hole. I found a way out, and I can show you.
And you love being that role model.
Absolutely.
I know I can make her smile.
Yes, because
you love being that role model because now you know where you've been, and you've got a master's. You're going to get a doctorate. That's a real good role model.
And the biggest part of it is just
right.
the
Absolutely.
wellness.
Smiling.
This is a whole person-centered ability to look at things.
Jamel, so at what point did you say, or did others say, "Hey, we ought to focus on nutrition"?
Well, I had the opportunity to start doing my internship at the Peer Alliance Recovery Centers in the Bronx. And as I was doing that, the assistant director as well as the director, they said, "Hey, we have something new. Would you like to be a part of it?" And for me, the word nutrition meant, hey, what am I going to be, a rabbit? I have to just eat lettuce and things like that.
And I'll bet, what does the public know about nutrition? That could be what they think about nutrition.
Absolutely. So then I was able to get some guidance, take a couple classes on learning what we put into our body, how it affects our mental health. And that's one of the things that I focus on in all of the workshops. And now it's becoming like my whole being. Like
Wow.
I walk different. I do different things.
You do that because you do this program, or you do that because you're eating better, or both?
I think that both. Because we like to say that food is mood. Right? Putting the right things into our bodies, as well as being aware, right? Because a lot of us, we live next to corner stores, things like that, and it may be more convenient to just grab a snack that is not as good for us, but then we're waking up. And what I like to say is that I know something about all of us tomorrow, that we're going to be one day older, right? and waking up sometimes, I feel like that old squeaky door, and that had to do with what I'm putting into my body. All of these things, especially through our substance use, right? We have done damage to our body.
So you have brought others into this program. Now we have photos of you, which we're going to put up, but you do cooking and demos. Just talk about the program, and then we're going to ask the assistant director where it fits into Samaritan's program. But go ahead.
Yes. So every Tuesday at the Pure Alliance Recovery Center in the Bronx, and every Thursday in Queens, I do a nutrition workshop. And what it's focused on, again, is how what we're putting into our body, it affects, number one, our mental health, and also our recovery. Food as medicine. Instead of most of the times where we might want to find an alternate route or take some type of medications to help us out. Starting with a great foundation of what we're putting into our body will help us to think better.
Do people, are others who drug addicted, do they listen to this, or are they receptive to it? She's
Absolutely.
shaking her head. Yes, you'll get the first whack.
Yes. So
people are like, wow, this is a way of doing something for myself that will ensure better health.
Absolutely, and one of the big focuses at the Pure Alliance Recovery Centers is to help our members to become more self-sufficient, right? And it starts with, the basic things. We talk about making your bed in the morning, all of that, but also your nutrition. And one of the other things that we started and implemented in the nutrition workshops is growing microgreens. And
nice.
And the members are like, wow, I can do things. So we're trying to fill that, we call that gap, because when we're first in early recovery, we're like, oh man, what am I going to do that's fun? What am I going to do? So we lean back towards what we know best.
And so it's not only the fact that there's nutritious food, which of course benefits everybody, if you can do that, but also it's the activity of doing it, and I'm just thinking this out loud, and the goal to say, hey, I'm going to make this, or I'm going to be involved in this, or I'm going to think about it, or shop a little smarter, or something like that, is all part of what a person needs to recover.
Mm-hmm. Absolutely.
Where does this fit in the whole PARC program? Is it something that's required? Do you introduce it all the time? Do you wait till somebody comes in? I just want to know where this whole nutrition thing falls.
So Samaritan Daytop Village reaches over 30,000 people throughout their treatment programs and various different residentials, inpatient and outpatient. When a person comes in to address their substance use or misuse issues, they often have to relearn how to engage in a healthy way of living. Samaritan believes that this is an important part of, because we live in different types of settings, that people should learn how to eat healthy. It helps the mind recover. Because people see recovery as just a substance. I just want to finish this. Recovery is not just a substance. It is the one symptom that goes away, and then you have to recover the rest of your life. So.
Yeah, I mean, what you're saying makes total sense. Let's just say that you didn't have this program, and from a mental and emotional point of view, you dealt with somebody who is using, who's drug addicted, and then they go back out and their habits of eating McDonald's or eating potato chips for breakfast, that's not going to, what Jamel was saying, not going to help them feel better.
No, I mean,
you know what I mean? In the long run, and it's not going to help them move to the next step unless they eat better.
Right, but then we have to look at the health disparities, right? So there's people coming home and realizing that's the biggest part of it.
Oh.
So is that we have people who may have been using substances, haven't seen a doctor in a while, not able to identify with whatever is going on with their diabetes or high blood pressure, hepatitis C, like all of these different type of health disparities. We were introduced to Elevance, which is a grant from
We want to credit them.
yes,
right? Who's
big
able-
time big credit to and shout out
Elevant,
to
is that how
Elevance
it- okay.
Health. Yes,
Right.
they have coupled with Samaritan some years ago as a consultant, and they brought on the initiative to include food as medicine as
Right.
part of the recovery movement to help people build a healthy way of living, not just from substances, but from nutrition, health, reducing opportunities or reducing the possibilities of wind up in a hospital, medication, stuff like that. It's a whole person perspective.
Jamel, do you have any firsthand experiences of others who you've seen and you've worked with them through this program, and then you say, wow, look at this person, he or she is now doing better?
Absolutely.
Yeah, I'm waiting to hear that. That's what we want to hear.
This is probably the number one reason why I really enjoy doing this. There was a member that had came in and she said, "Oh, Jamel, every night I get the family-sized bag of Doritos and I eat the whole entire bag."
Excuse me, I don't mean to laugh.
And the big thing is with the nutrition, we tie everything back to our recovery. So I let the member know, one step at a time, little steps. Maybe you're not gonna just not eat Doritos anymore, but how about shrinking the bag a little
Half
bit?
a bag.
And
Do
2
the
weeks
50-cent bag instead of the $4 bag. Yeah.
Absolutely. And that's pretty much exactly what happened. 2 weeks later, she came in and she was smiling. And you could see this little brightness on her face. And she was like, "Hey, Jamel, I want to let you know that I went from the family-sized bag to the dollar bag." And I was excited.
Do people who come in, do you get them to kick the habit first, or you just accept the habit and then work with them till they somehow get themselves off?
Another outstanding thing is that everything is person-centered. Right. So we don't want to just say, "No, you can't do this. No, you can't do that."
We know the just say no thing.
That doesn't work.
Yeah.
And so, yes, wherever the person is at is what we are going to work with. Because I know for myself, I know myself the best, just as you know yourself the best. And if you're coming up with some positive solutions, we're going to build on those strengths. And that's what the initiative is also doing, is building on strengths. Where would you like to be? What do you see yourself in 2, 3, 6 months from now? And how can we help you to get there?
And nudge your friend next to her and say, "She got a master's."
That's it. That's right.
Why is Samaritan Daytop Village uniquely qualified to implement a program like this? I mean, this fits into the concept and the vision of how you deal with people. So just talk about this program fitting into the range of services that you have.
So Samaritan Daytop Village is suited very well for this type of program because we have people who come in on their own. We have people who, at some point back in the day, they would say were mandated to come into treatment. And when they come, they seek just the beginning parts of what it is that they need, but they get so much more. We have the opportunity to reach people at a higher capacity because of the service provision that we have.
And we talked earlier briefly about the health initiatives and all those kind of people come in with diabetes. Many people who are substance abusers have diabetes. So I want to do this for the general public. You have the food as medicine workshop. A PR person told me, ditch the donut. That's an interesting idea. but here's the food as medicine workshop. This is Mondays and Tuesdays, 11:30 to 12:30, for the general public or people specifically who are substance abusers. To talk
Jamel,
about.
who's welcome to your food as medicine?
Everyone is welcome.
Everyone is welcome.
Everyone is welcome.
So this is Monday and Tuesdays. We could put that up again, 11:30 to 12:30 at 510 Cortlandt Avenue, and they're very, very specific programs and the opportunity to do food as medicine workshops. And then the other one, which we had just put up every Tuesday starting July 15th. What is that?
Yes, starting on July 15th.
You love this, I know. This
is going to be great. So we are starting our cooking demonstrations, and recently I got my food handlers certain certificate. So I'm able to help out the community and our members a little bit more. And what is actually going to be focused on, because some of our our participants may be even homeless or staying in a shelter or things like that. So for the first one, we're going to do microwavable healthy meals, and we're going to be
So
cooking
they could take
from-
it and pop it right in the microwave. Oh, I
Absolutely.
like this so much.
Just so, because if I came out there cooking a steak and everything like that, they're going to look at it like, well, hey, I don't have the facility to do that. I don't have the opportunity to do that. And maybe even we talk about some of the challenges, which is having the funds to even get some of this stuff. So beyond just having the workshops, we provide resources for our members to be able to get the healthy foods that they need.
You know, we're almost out of time. The beauty of that, part of the many beautiful things about it, is the indication that there is somebody here to support you and there is hope for you. To
Yes,
me,
sir.
that is a very good thing, and you expressed it, you both expressed it really, that I was out of options, I was out of hope, and that's what you restore. I do want to mention the phone number, 929-244-1500, or you can get to PARC Bronx at SamaritanVillage.org. Ms. Evans will give you the final word. What do we want to tell people about Samaritan, about the peer recovery program, and of course about the nutrition program? Ditch the donut. They don't want me to say that anymore.
No, we're not ditching the donuts. Eat less of them. So what I will say about Samaritan Daytop Village is it is an awesome place to come and get connected.
Clearly.
And even if we find that some of our programming is not suitable for everyone, we still connect them to the best possible resource in the community. The best thing to know is that education-wise, people don't always know where the resources are. They may want to seek something, but not necessarily know where to start. You can start at 510 Cortland Avenue, the second floor, Peer Alliance Recovery Center.
Right.
And the other best
and
part of that is
ask for Annette.
ask for Annette.
She'll be
and
there.
just say, I saw this wonderful program on BronxNet, BronxTalk, and we would like to be, get more information.
Beautiful.
The one other thing I'll tell you about is everything at the PARC Peer Alliance Recovery Center is free.
Wow.
Resources. You don't need Medicaid. You don't need money. You don't need an appointment. It is Monday through Friday, 10 a.m.
We
to
got to
6.
run. I'm just going to say the bottom line is there's help.
There's help.
There's ways that you can contact people. There are ways that people in the Bronx will support you and give you some really good ideas, and maybe you'll do real well. Thank you so much, Annette Evans and Jamel Lewis. We appreciate everything you do. Fantastic is my bottom line for this.
Thank you.
Thank you.
So that will conclude the program. We want to thank our producer who sat in today is Stephen Powell, and we have a great BronxNet production and editing crew. And of course, to you too, it's the people of the Bronx that keep us doing what we do. We'll see you next time. Good night.